In the first activity, we can see our client tying his shoes. As he is bending at the knee to tie his shoes, this involves a lunge movement pattern, with a relevant feature to this activity and pattern of movement being keeping the knee in line with the hip as well as the foot. You should be able to draw a line through the ankle, knee, and hip when viewed in the frontal plane, and trying to keep all three joints stacked, so to speak, avoiding knee protruding inward or outward. In the next activity, our client is seen picking up a case of water bottles from the floor. This activity demonstrates a hinge pattern of movement to be able to get in position to pick the bottles up from the ground. A key relevant feature would be that of limiting twisting of the back, which would involve keeping the shoulders in line with the hips and not allowing either to come out of this alignment. This is an effort to limit spinal rotation in the transverse plane. In this activity, our client is grabbing a pan in the kitchen, but from the bottom cabinet. This activity involves the movement pattern of a squat, allowing the client to reach the pan from this cabinet. A key feature present is the flexion and extension of the back when squatting, to limit any excessive curvature when in flexion or extension, in focusing on having a tabletop back or a neutral spine throughout the movement pattern. Lastly, our client is seen moving a piece of furniture, specifically a table, in so utilizing a push pattern of movement, with a key feature of this being to keep the shoulders down, or in more specific terms, away from the ears. To aid in this, imagine a line through the ears and the shoulders, and try to keep these equidistant throughout the movement, making sure not to allow shoulders to be by ears in a shrug motion.
Our first exercise is the bodyweight lunge. After stepping and descending into the movement, you want to ensure that your knees stay stacked over your ankle and your hips stay stacked over your knee in this bottom position. You also want to ensure that while in this bottom position, your weight is evenly distributed between your medial and lateral side of your foot to maintain the hip, knee, and ankle alignment. Our next exercise is the good morning. To perform a good morning, you want to bend forward while pushing your butt out back as far as you can while maintaining a straight leg posture. At the same time, you want to ensure that your back is level across your shoulders from left to right, as well as by your hips from left to right, to prevent any twisting in the spine that could damage your spinal erectors. Our third exercise is the air squat. To perform the air squat, sit back in your heels while maintaining a neutral spine. Do this until your thighs reach at least parallel with the floor. From this position, you can begin contracting your glutes and quads in order to stand back up. But while you do this, make sure that your chest and your hips rise at the same rate in order to prevent any shift in your weight that would cause you to lose balance. And also be sure to prevent your knees from collapsing inwards during the concentric portion of the squat. Our final exercise is the push-up. To begin, start in a plank position with your hands slightly wider than shoulder width and your feet at shoulder width apart. Lower yourself towards the ground until your upper arms are at least parallel or until your chest is touching. Ensure that your elbows don't flare out during the movement to prevent any damage to the joint. Then, press. While performing the push-up, you also want to ensure you maintain a tabletop body posture and do not allow any sagging to occur in your hips.
Performing and training for correct forward lunges can lead to transfer, as clients are trained to maintain a neutral spine and a hip-knee-ankle alignment in a lunge situation, such as tying a shoelace. This can lead to injury prevention and being able to stay in the position longer to tie shoelaces better. It is important for a client to learn how to perform good mornings in a proper position, including neutral spine and keeping shoulders back. Training good morning behavior can help clients to perform lifting a heavy object like a case of water bottles in their daily activities and work. Practicing air squats can help clients to maintain a stable balance while reaching for a semi-heavy object under the center of gravity. Trained clients should be able to contract their glutes and lift their chest at the same time while moving up to maintain balance. Push-ups help to develop chest muscles that assist force in the pushing motion. It also helps to keep their elbows and shoulders back to use the pushing motion efficiently and prevent joint injuries. It is important to have the proper push-up behavior ingrained to prevent elbow injuries.